Iceland. And it's an absolute pleasure to have you join us for today's seminar. For those of you that have joined us for previous seminars, you'll know that the purpose of the Lancet Commission is not just to report, to produce a 25,000 word report at the end of several years of work, but more importantly, to hear from and engage with the ongoing discussions around the world about the intersection of gender and health, and particularly the intersection of gender inequality and health inequities. But more importantly, what can we do to make a difference? What can we actually do to make things better in terms of reaching goals of gender equality and health equity? And I can't tell you how delighted I am today to be able to hand over the baton not only to Emma Rule at the United Nations University International Institute for Global Health, who's going to be your host for the rest of today, but more importantly, being able to hand over the baton to such an exciting group of young people really making a difference at that intersection of gender and health. And you'll be hearing from them throughout the rest of this hour. Could I move on to the next slide, please, Em? Thank you. So this slide in some ways is a little bit redundant because let's face it, if you're listening to me now, then you've found us and you're on a platform and you are very, very welcome to join us for the next hour or to stay with us for the next hour. But if I could just go back one slide, actually, please, Em. Thank you. If you're watching us on YouTube, for example, you can either post a question to us on YouTube or you can tweet at us. And if you just look at this slide, you'll be able to see the tweets where you can post questions to us, and we'll be putting those Twitter handles into the chat as well. And at the end of the day, this is not only about hearing from our four young, exciting panelists, but it's also about hearing from you. We want to hear your questions. So if I could go to the next slide, please, now. There are different ways you can send your questions to us, as I've just said, but if you're on Zoom, please use the Q&A box for sending us your questions. And you can either have questions to the panel in general or to individual panelists. But importantly, tell us who you are and where you're from so that we can, essentially, so we know who we're having a dialogue with. Thank you. But we'd also encourage you to join us in the chat box, which will be live throughout the next hour. And it's an opportunity not only for you to get to know more about all of us and engage with us, but also to engage with each other. Most importantly, please sit back and enjoy the coming hour. Emma, over to you, please.
Thank you very much, Sarah. So just to give you a quick idea of where we'll be going as we spend the next 55 minutes together, I'm going to give you a short presentation that talks a little bit about where this work came from, and then I'm going to very quickly pass over to our fantastic panelists, so you get to hear more from them than you do from me. Just to echo Sarah's comments, we really hope that this is a live and participatory conversation as much as the platforms allow. So do drop your questions, comments, feedbacks into the box. All of our panelists will be seeing your messages as well, and hopefully we'll also be able to respond to you in real time as we go. So as Sarah mentioned, my name's Emma Rule. I'm a senior researcher at the United Nations University's International Institute for Global Health, which is where the Secretariat for this commission currently sits. And part of my job is to kind of work with the co-chairs and our commissioners and the other fantastic members of the Secretariat to keep this commission moving. Now, in the early days of the Commission, there were lengthy conversations, not just about the potential questions and content of that final report that Sarah referred to, but also about the underlying principles. And there was a shared sense that a feminist, intersectional, decolonial and political approach is needed to achieve transformative change at the intersection of gender and health, and that those tenets should also guide the work of the Commission. We knew that to do so, we needed to bring in voices beyond those of our commissioners, fantastic as they are. And in doing so, we also wanted to interrogate notions of what types of evidence inform decision-making processes and commissions such as ours, and to think about who is considered an expert. To that end, led by Commission co-chair Pascal Alaté, now at WHO, but previously with us at UNU IIGH, we were fortunate enough to secure funding from the Ford Foundation to support a process of engaging with youth-led feminist organisations who were working at the intersection of gender and health. Now, why is it that youth and community voices are so important, not just to this Commission, but also to this work as a whole? So I think what this year has shown us, if nothing else, is that despite the significant strides forward, depending on your definition of progress, that have been made in the realm of gender and health, not only is progress at risk of stalling, but can, as we have seen with Roe v. Wade, be undone entirely. And so change cannot and will not emerge from sticking with the status quo as it is. As we look at the current state of gender and health, and we think about where we want this area, this intersection to develop and grow in the years to come, it's clear that new voices, new ideas, and new ways of working are going to be vital. And that youth and community voices are especially crucial to seek out if, as we do, aim to identify more contextually suited and forward-looking ways of working. Youth-led community groups are particularly suited to change the way we want to see and the paths that we want to take there, as they're the ones inheriting our future, and thus it's vital that they are part of the architects of that future. And while I have this slide up, I just want to acknowledge that these images come from our partners, all of whom, as you're going to hear, are doing absolutely fantastic work, both on the ground in their communities, but also to shape national policy and international dialogue. Now, I mentioned at the outset that with this Commission, we had wanted to take an explicitly decolonial and feminist approach. And so those were some of the guiding principles as we chose who we wanted to engage with as we did this work. And there were three kind of guiding principles to this decolonial feminist approach. The first was to think about a diverse range of stakeholders. And really, we wanted to push ourselves from working beyond our usual networks to bring in voices and engage with people that were new to us as an institution, and new to us as a commission, to really try and broaden out the conversation. We also wanted to disrupt this idea of kind of the Commission being the experts who were just going out to seek the input of young people, and that we would then kind of own that and run away with it. So we've thought very carefully about what it means to have equal partnership, to set up ways of working that very explicitly position all of the amazing colleagues that you're going to hear today as our equals on this journey. Because the reality is they are the people with the lived experience, and we are here in some ways to use the platform that we have to ensure that that lived experience and expertise is being platformed in new ways and introduced to new people. And we also thought very carefully about what meaningful outcomes would look like. So we have a very explicit output in terms of the Commission's report, but what do our partners get out of working with us? What's the way that we further this journey and enhance everybody involved in the process? And so this kind of acknowledgement of our partners as experts on their communities, and in their contexts, was very important to us and has guided a lot of the way that we have worked together. So what have we done? For the past kind of 10 months now, we've been going on a process of getting to know each other. We've had 5 90 to 2 hour minute workshops where we have discussed a whole range of topics that sit at the intersection of gender and health. We wanted to understand and to share with each other some of the ingredients of success that have led our partners to be able to do the great work that they're doing, to think about a process of not just where we are now, but what it might look like to kind of fundamentally reimagine the intersection of gender and health in 15, 20, 25 years. And then to think about what we would need to do to make those possible futures a reality. As we now move into the second phase of our work together, we're opening with this webinar for them to share the process with you. And we're also looking for ways that we can continue to partner together beyond the life cycle of this current project. And so with that, that really kind of is enough of me and enough of us. And I want to take this opportunity to give you a brief introduction to the 4 fantastic people that you're going to be hearing from today. So first we have Jessica Boyson, who's based in South Africa. At 22 years old, Jessica identifies as a second-generation feminist. She is a mentor to adolescent young girls within the feminist movement in South Africa, and also is responsible for handling communications for the organisation Activist Education and Development Centre that she is a part of. We also have Lucy Combe, the Programme Officer at Zamara, joining us today. Lucy is a young feminist growing her career as a women's rights and sexual and reproductive health advocate. She is intentional in creating platforms for young women to speak about and amplify their own issues and solutions. And in her role at Zamara as Programme Officer, she oversees both programs and supports communications. Next, we have the Reverend Mwande Lulongolo, who is the Programs Manager and also founder of the Lulongolo Foundation. He was born in a small town in South Africa called Tabunkulo, and having matriculated from secondary school and then studied for a diploma in theology at St. Bitts College, he found that he was being called on by both his community and local policymakers to do increasing amount of works in his community. And so we're going to be hearing more from the Rev today about the organisation that he founded and the work that they do. And finally, we have Melvin Obola, who is the Digital Advocacy Associate at the Young Women's Leadership Institute in Kenya. Melvin is a Pan-Africanist and a young feminist activist who's passionate about gender, racial and social justice, with experience in advocating gender equality through grassroots and digital activism and advocacy. She has over 4 years of experience in the capacity strengthening of young feminists and women activists in Kenya, and has been called upon to give keynote presentations and talks at both the 2019 Women Deliver Conference in Canada, as well as receiving an Inspirational and Innovative Leader Award from the Canadian and British Red Cross Societies. Now, for those of you who've joined us for previous webinars in this series, you will know that we occasionally, when we have panelists joining us from countries where electricity or internet connectivity can be problematic, have had issues with them being able to fully share their message with us. And so for that reason, today's discussion is going to take a hybrid format. We have asked all of our panelists to record the first part of today's discussion so that we can ensure that you really do get to hear about the work that they've been doing. And then when we move to the Q&A, they are all here with us in person, and connectivity permitting, we'll be able to answer those questions live. They will also, as I mentioned earlier, be with us in the chat. So as we're going through and we're watching their questions to each other and the discussion that they have, please do put any questions or comments that you have. Some they will respond to as we go, and others we will save for the main Q&A portion. So with that, just bear with me 1 minute while I swap over to the recording.
What is the role of women rights organizations in creating demand for action towards systemic change, especially policy influencing? Thank you.
Women's rights organizations must make sure that everyone understands why women's rights are important. Millions of women around the world continue to experience discrimination through laws and policies that prohibit women from equal access to land, property, and housing. Economic and social discrimination results in fewer and poorer life choices for women, rendering them vulnerable. GBV affects women globally. Women are denied sexual and reproductive health rights. Women also face discrimination due to factors as their age, ethnicity, ability, and socioeconomic status in addition to their gender. Women's rights organizations must continue to make sure that the above-mentioned issues that women face on a daily basis are always on the agenda in every place, space, and platform that is attended, and this includes policy advocacy and participating in law reform that has an impact on women's health and rights.
Our role as an organization is to advocate for more policies on women's rights and empowerment. Also, as a foundation, we do comment on white papers released by government, whether online or on public hearing meeting. We also encourage men to take part in those hearings, to comment, to engage, and also to learn, and also unlearn some of the things that we have been taught by the societal expectations. Part of the work that we do as the foundation towards policy changes, we also sit in roundtable discussions with policymakers in terms of your ward councillors, your office of the premiers, your office of the mayors. We also submit in terms of challenging the status quo when the need arises as the foundation, so that we can create an environment of engagement with the policymakers. Part of our volunteers are sitting in different forums and structures that speaks to policies on GBV, on education, and on health. The work that we do with the boys, we teach the boys to be sensitive, boys to be carers and support system for young women, starting at home, school, in the community, especially on health-related issues and gender issues. As a foundation, we, at quarterly basis, we have what we call men's dialogue, to dialogue about issues that are affecting men and the role that we can play as men in creating equal opportunities for every gender that we live within the society. We also have what we call men in business and men support groups. Within the support groups, we also have established an on-call buddy, a person that you identified as your buddy to work with you and be your support system. That's how we influence.
Women's rights organizations and young feminist-led movements have the role in challenging patriarchy within our societies and demanding for systemic change within our communities. Many of the rights that we are enjoying right now were fought for by the many women's rights organizations that were founded before us. As women's rights organizations and young feminist-led movements, we have the role in challenging patriarchy and misogyny within our communities, and that includes challenging power and oppression and speaking up whenever oppression happens. We have a role in supporting grassroots, young feminist-led organizations and CBOs in continuing fighting for the dream, and that is women's rights. Women's rights organizations have the role in ensuring that whatever we know is passed down to the people we work with. Ensuring that we build and strengthen the capacities of the people that we work with in policy advocacy and change, and ensuring that they're able to understand the different stages of policy advocacy within their communities, and for them to also understand the different policies around women's rights. for them to also speak about them with their different leaders within their communities. As women's rights organizations and movements, we have a role in co-creating spaces for feminist learning.
What are your organizations doing to ensure that young people in all their diversity are receiving the health information that they need?
As the foundation, we have a working relationship with schools in the Klipfontein district, Mitchells Plain district, Khayelitsha, and other districts throughout the province. In those schools, we conduct sessions on health-related issues. We give out pamphlets, we dialogue, we sometimes conduct sporting activities that are addressing health-related matters amongst the adolescent boys and girls. But most importantly, we have conversations that we call dialogues with the learners in those schools, where we educate, and they sometimes ask questions, and we answer those questions with the purpose of educating them and addressing them around the myth that they have been taught by the society. And we also run out-of-school programs that are targeting the youth that has dropped out in school, the youth that is not at school, and in the communities, using the community libraries, the community halls, the parks. We form partnerships with NGOs and the Department of Health so that they can not only access information but the services during those engagements. And we have reached more young people. And the pamphlets that we carry and distribute in the shopping malls, in the parks, and we also run taverns, dialogues, where we engage the youth in taverns during the weekends on so many societal issues, including health. And we also distribute condoms in taverns and other spaces where young people gather for entertainment and enjoyment. And we come in as the organization with other organizations that we work with, distribute condoms, educate, share information through pamphlets and short videos, and I'll answer their questions that they might have regarding health-related issues.
We have been able to use our digital platforms to share information about women's rights, to mobilize for policy change, to associate our organizing with feminism and feminist leadership. We've also been able to hold community conversations in different parts of the country. And these community conversations include talking about women's rights, talking about how our communities impact our lives, talking about LGBTQ rights within our community, and how even our administration have been discriminative in terms of LGBTQ rights. And having those spaces, safe spaces to talk about our experiences as women, experiences as gender non-conforming persons, and then how do we work together to ensure that our rights are respected and we mobilize for policy change. We have continued to create spaces for feminist conversations and open new frontiers for adolescent girls and young women's engagement in policy processes. We have also developed from information sharing platform and network to becoming a hub of where adolescent girls and young women access information and organize action depending on what their call of advocacy is. We have continued to use our digital platforms and social media to ensure that we pass the information on women's rights and ensure that people are rich with the information. We have also continued to use our different one-on-one meetups and community conversations to talk about women's rights movements and organizing and how we're able to come together to organize for change. This year, and around April, we were able to hold a young feminist convening where we convened 35 grassroots feminist leaders who were able to talk about what they want to happen, and we developed a Young Feminist Manifesto, which is in the process of being published.
Really, just looking at how Zamara Foundation has been using the platform to share information. For the past years, we have been consistent and deliberate in ensuring that not only are we sharing the messages and factual information online and on our social media platforms, but we also have a voice, the voices of women, a voice of a survivor, just ensuring that these messages are authentic, they're coming from an experience point of view, they're coming from a lived reality, not just facts and data, but what are the realities on the ground. So we provide this information in different ways that will engage these young people and will make them access and have fun at it at the same time. So we do this in different ways at Zamara Foundation. First of all, we co-curate these conversations with these young women and girls. And while we are doing this, we ensure that these groups of young women and girls are of different diversity, so that we are inclusive in our messaging. So we include them and engage them meaningfully to co-curate these messages and content that then will inform our online conversations as well as our other media packs. And how we disseminate this is we ensure that the dissemination of this and the packaging of this, the channel used, are as broad and as layman as possible. So first of all, acknowledging that young women and girls access this information online, and most of them actually access this information on our social media platforms. So how do we provide a platform that they can rely on in terms of the factual information, a credible source of information? So we are slowly and gradually becoming an information hub online with our consistency, with our engagement, with the growing movement that we are having online as well. We are realizing that that platform is really having a potential. The social media platforms and other online platforms are actually becoming more and more diverse and more inclusive, and we're having a community actually online and a movement that can speak about these issues in their own language. They understand the issues, they understand the context, they're giving, they're debunking some of this misinformation that we are seeing online, and really the overall of now what beyond now the conscious raising, beyond now the awareness raising and information sharing, we work as an organization, we work towards now providing or ensuring rather that the environment for these young women and girls in accessing this information, and not only information but services, is really enabling for them and easy for them to actually access these services and information. So what I can say is we are a mix, or the strategies we use are a mix, are multifaceted, that include how we are advocating, how we are creating awareness at the same time, how we are working with stakeholders to build a movement, and how we are working with them on the long term to change their behaviors through partnerships and through community strategies. So that is the approach we use as Zamara Foundation. Thank you.
What meaning role do you think men-led organization should be playing concerning health and gender issues? And are your organization open for strategic planning in terms of addressing gender and health issues?
The men-led organizations should be working with men and holding conversations with men about respecting boundaries, respecting women's bodies, respecting women's rights, and ensuring that those men are able to also talk about women's rights with their colleagues, with their friends, with their families, with whoever they meet. Because Oppression, patriarchy, misogyny is centered around power. So when they're able to also challenge power and they're able to talk about women's rights in a way that doesn't discriminate, the men-led organization should be able to convene community conversations with boys in understanding the internalized patriarchy and misogynies that they grew up knowing, and then they're able to unlearn those and learn new ways of working with men and with women and associating with women and respecting boundaries and the female body, and working together with other women's rights organizations in understanding then where can they be able to come together to work. Men have a role in understanding what being a female is, because they really don't get it, they don't understand. We're talking about how female body grow, how the female body changes, and how then that comes with different emotions. They should hold conversations within themselves. They should be able to understand what women's rights mean in a feminist perspective. And they should be able to organize community conversations with men and boys.
Looking at the role that men-led organizations play in the fight against inequality, oppression, and the fight towards a gender-equal society, I would say, first of all, is to realize that these men are coming from a privilege that was set by the patriarchy that was there from ages ago. So the first thing, I think the first role the men-led organization and even the men themselves could play is acknowledging that men have a privilege and they are born with it. And this is as a result of the patriarchal systems, patriarchal laws, as well as the time that the patriarchy has been in existence. So that is one. The other thing I think that is key and that really would speak is the solidarity within the movement of women rights and feminists as well. So when we're talking about solidarity, it's not just the rubber stamping that we see in events, the rubber stamping we see in the campaigns and some of the interventions that we see, but really the intentional, the proactiveness, the deliberation of how we support, or how they support the daily struggles of us women when we're going through these oppressions, when we're fighting towards this inequality. How are they not being a liability but are being a driver towards the change that will bring women at this equilibrium that we seek to attain with gender equality. So the other thing that really speaks is now them helping us helping the systems transform power dynamics. And how do we do this? It is in the small ways, even in the households. How are we acknowledging, or how are we celebrating the empowerment of women and girls, for example? How are we acknowledging that women and girls have power within themselves, have potential to do whatever they want to do with their lives, with their bodies, with their careers, etc. So I would say all this will really inform, or will really drive us towards some change in regards to the interventions that we are having, as well as it will really facilitate us getting to the gender equality, even in a shorter period of time. Yeah. So being allies, being there for the support, showing solidarity, acknowledging that they are coming from a privileged point of this conversation, and basing this on the patriarchal systems that are there. And with that, I think we will make strides towards gender equality. Thank you.
the issue of gender, particularly gender-based violence, cannot be addressed without women. It is important for women's-led organizations to work with women and women's rights organizations and other organizations to address gender and gender-based violence that affects both men and women in our society. Although in the South African context, it affects women more because the statistics inform us that men are most likely to be the perpetrators of violence. In the same way, it is also important for women-led organizations to work with men to address gender, in particularly gender-based violence. Because women cannot address the issue of gender and gender-based violence without men. If men want to be our allies as women, then men and women need to work together. The role that men-led organizations can play in issues of health and gender is to make sure the same information that is shared with adolescent girls and young women are also being shared with adolescent boys and men. Men-led organizations should encourage health-seeking behavior to reduce stigma and discrimination associated with health-seeking behavior because men are less likely than women to use health services. Men-led organizations should engage in dialogues that will allow adolescent boys and young men to share and talk about their experiences, whether physical, cognitive, or psychological, so we can understand how the changes affects and impacts in how adolescent and young people feel and think and make decisions and interact with the world in and around them. Lastly, men-led organizations can make sure that they do capacity building sessions on gender-based violence as a foundation for adolescent boys and young men. Thank you.
What does the future of young feminist organizing look like in your country?
Thank you so much for the question. And the question is really interesting to just reflect on. In the next 10 years, some of this youth-led, young feminist organizing, where will we be at, say, 10 years from now as Zamara? So we're looking at a young feminist organizing. What the future for the young feminist organizing will look for me is one that is outspoken, first of all, very outspoken, very courageous, very creative in pushing for transformative change and social justice within their contexts. I'm also looking at an organizing that is very diverse and very intentional within how they are organizing intersectionally, ensuring that there's representation of each and everyone, but ensuring that they are as inclusive and as diverse as possible, and ensuring that the movements are intergenerational. And with this, I mean that there's mentorship of the older movements or the bigger movements to these young organizings. There's hand-holding, there's mentorship, there's coaching that is going in place with the young feminist organizing. I'm also looking at a well-resourced and here I'm speaking about both financially and capacity-wise. How are these funds flexible to ensure that these young feminist organizing are accessing these funds? For example, how are smaller and volunteer-led feminist organizings accessing these funds? How flexible is it? And with all this, I believe that the interventions will be unconventional and we will actually achieve the social justice that we work towards at the end of the day. Thank you.
GBV and femicide plays a big role in uniting our youth activists. Young people, and particularly young women of color and young LGBTQI youth, are at a huge disadvantage when it comes to accessing economic freedom and educational opportunities and claiming their sexual and reproductive health and human rights. We continue to face social, economic, and cultural barriers, and because young women are the experts on their own experiences, they know how to address these barriers, and all we need is support. One of the reasons why organizing is important is because it empowers young people. It believes in a full social, economic, and political equality for young women, and particularly young women of color and young LGBTQI youth. Young women need to participate and be included in leadership to bring to the forefront the voices of young people and their experiences. Despite the strength of feminist organizing, violations of women's rights, the lack of financial resources, and gender inequality persists. Funders must consider and recognize the value of diversity of young feminist organizing. Funders must support girls and young women collective efforts led by young people. In conclusion, young feminist activism is a crucial part in feminist and social justice struggles at all levels, and young women and girls and young LGBTQI youth activists have a vital role to play in the strengthening and sustainability of feminist activism. I also think better organizing and coordination and collaboration is needed amongst youth and women's rights and feminist organizations, with the focus of genuinely putting the needs of young people, in particular young women of color in young LGBTQI youth, first. Thank you.
The future of feminism in South Africa, I can safely say that it's great, based on the influence and the growth of feminist-led organizations within the country, and their influence in policy making and in decision making in strategic levels of government, NGOs, and private sector. Many people are starting to understand what really feminism is within South Africa, and also they are acknowledging and taking part in the activism and addressing the challenges that feminists face. We are seeing more women in leadership positions, both in government and private sector. We are seeing more young women in higher learning education centers graduating, but mostly as a sign of victory for South African feminist-led organization. The South African government has established a women and children ministry within government led by a woman. And South African women have access to votes, and they are majority in parliament. And we are seeing a vast improvement in access to household services, education, and health care, though we still have some backlogs in that regard. By those few things that I've mentioned above, I stand firm in concluding that feminism in South Africa is safe and has got a future, and it's making a huge impact, and it's winning strides. I thank you.
So thank you very much to all our panelists for taking the time to answer the questions that they put to each other. What I would like to do now is to bring those of the three panelists who have been able to join us live today. Unfortunately, we've lost Jessica from AEDC due to connectivity issues, to answer questions that have been put from the audience. But first, what I'd like to do is just to take a moment and ask each of the panelists whether they would like to reflect on the responses to the questions that their colleagues gave them. So Melvin, if you're with us, I wonder if you would be happy to start with your reflections on the responses you received.
Yes, thank you so much, Emma, and everyone in this webinar. I appreciate you creating that time to be here. I'd say much of the questions that have been answered, they've given their perspectives on what they think would work within our communities. And I feel like even how the role of men-led organizations in gender and health, and what Rev and his team are doing is to co-create that space where men and women can exist, and for them to also understand the different roles men play in gender equality. The role of women's rights organizations in demanding for policy change and systemic change within our communities have been mentioned and by my colleagues who are here. But I'd like to echo that we have a role in also as women's rights organizations and feminist activists is to come together as a movement fighting for gender equality. I'll take us back to 1995 during the Beijing Declaration and Platform for Action, which was adopted by the UN. There are different organizations, private sector, government states who came together and made the declaration. This was made a success because of many human rights defenders, women's rights organizations demanding for justice for women's rights. And it is our role as women's rights organizations to continue fighting for that dream and defending for the gains that we have achieved since 1995. Looking at even how the young feminist organizing has been in the past years, and looking at now the future of young feminist organizing, I feel it's a different kind of organizing at the moment compared to how it has been in the previous years, even before we were born. Looking at the history, the documentation that has been done, many of the documentation that has been done on young feminist organizing it's not available. I'd say there's very few documentation that has been done on young feminist organizing. And the few that has been done have been done in a way that dehumanizes the female body, I'd say. Sexual violence, gender-based violence, cyberbullying has been a great, it has risen in the past few years. When COVID hit, many women have been stripped of their worth online because of how they dress, because of how they appear. But this has been also caused by the existence misogynistic views of the female body. And I'd say even on our campaigns that we've been running since 2020 on My Dear Body is to just recognize that the female body exists in different forms, and that in different parts, in different stages of life, our bodies change. We cannot be the same after giving birth. And we have our baby part and we are very proud of it. And our bodies change depending on everyone's genes and everyone's existence in how they appear. It doesn't mean that they are worthless or they don't exercise. I've seen so many people say, oh, your body you're too fat, you need to go to the gym. You're too slim, you need to eat more. You are too, such things. But then those are the kind of things that have been brought about because of the misogyny and the patriarchy that we are continuing to fight. So, and I'd echo my colleague Lucy for her comments on how they've been able to organize virtually and physically to enable that for the people they work with to understand the deeper sense of gender-based violence and power. Thank you.
Thank you so much, Melvin. And I think all the points that you make there, particularly about those external factors that influence the way that we not only see ourselves, but others treat us, are really key. And so with that, Rev, I hope that you're with us, because I'd like to come to you next. During our conversations together, I often used to talk to you as our feminist Trojan horse, looking to undermine the patriarchy. And Melvin talked about the Our Bodies program. And I know that you've been running the Men Must program and this idea that the patriarchy doesn't serve anybody. I wonder if you could talk a little bit more to that program and why you think that feminism is important for men and the patriarchy is so harmful to all.
Thank you. Greetings, everybody, the facilitator and our honored guests who are online all over the world. I've already been introduced as Mawande Lukongolo from the Lukongolo Foundation in South Africa. Emma, part of the challenges that we face as men, I always say this, and I stick by it every time when I speak. is the issue of inheritance. We have inherited a system that is now in 2022 breaking us in our time. It's no longer benefiting us. So part of the work that we should be doing, and we are doing as men, is to break the chain of inheritance, especially inheriting these bad things and practice when it comes to issue of gender and health. Remember, we've been made to believe that one, a man should not cry, a man should not show emotion, a man should not go to the clinic. There's a lot of stigma around in where I come from for a man to go to a clinic and a man to show his emotion. As a result, men are also finding it very hard to express the love they have for their surrounding, which is the family, the wife, the partner that they live. So what we're doing as the foundation, we are teaching young men and young boys to be carers, to be supporters, to be sensitive, to say to them, not that there is anything wrong about religion or culture, but there are things that we should be taking out. We should be doing away with. There are things that we should be starting to show appreciation. One of the duties that we have as men is to protect women, and not that women cannot protect themselves. They can protect themselves, but we also have a duty as men to play a protective role, also to be sensitive, amongst other things, the changes that my Leonard colleague has just talked about. We need to embrace those things. So part of the work we're doing as the foundation is to say to boys, it's high time that we show our emotions. It's high time that we learn more about the issues that women face, starting from the early age. Also, challenge the status quo. Of course, men are born with privilege of being a man. By virtue of being a man, born a man, you are entitled to some things, whether from the family, from the society. So we are saying now, we can live in an equal society with opportunities for everyone. So that's the part of work we are doing as the foundation, engaging young men in school, out of school, also in taverns, of course, in churches as well, because we've also formed strategic partnership with churches around tackling the issue of patriarchy. Because in South Africa today, you have more men committing suicide because the patriarchal system or arrangement are saying a man must. You know, Ms. Emma, when I asked my famous question, what if a man cannot must? So now that system that used to make men to be the providers of the household, the leaders of the community, today in South Africa, more men are not working. So do I cease to be a man if I'm not working? Do I cease to be a man if I cannot longer provide for my family? Do I cease to be a man if I don't hold any leading position in society? The answer is no. But we need to start to say to boys and men, we can live in an equal society with equal opportunities. Women can lead as well. I once said this, I'm continuing to say it. I've seen women-led households. I've seen CEOs, directors of big NGOs and companies who are men, but they were brought up by women. So we need to start to say to them, remember, you were raised by this strong single mother. Today you are a CEO. Open the gate for women. Not that you are doing any favor, because they also deserve to be in the round table. They can do it. That's our approach.
Thank you very much, Rev. Always inspiring. Lucy, I would like to come to you next, because I really want to ask you a question about inclusivity. So I know that Zamara has been doing work with people who identify beyond the gender binary across a whole range of identities. And we've also had a question from Joseph in the chat about working with individuals living with disabilities or those that are physically challenged. So I wondered if you could talk a bit about what it really means to work in a fully inclusive way, and also perhaps what some of the challenges are of doing so.
Yeah, thank you so much, Emma, for the question. And when we're speaking about inclusivity, it is not just having them on the table. It's beyond having them in the meetings or in the convenings, but just deliberately ensuring that these programs, this funding or these interventions are really engaging them from the inception periods. How do we engage the different constituents? For example, in coming up with a concept, as simple as a concept, how do we integrate even in our languaging while we are programming this inclusive language? And for the longest time, we've had the discussions around the accessibility of, say, the information. Is it accessible to persons with disability, for example, they're visually impaired, for lack of a better word. So these are some of the interventions that are in a small way making the change, but impactful at the long run. So ensuring that the messaging we are having online, is it accessible to all the persons that we are targeting? And this has been a challenge for us as an organization to just ensure that how we are having a dissemination of all forms of channels that will ensure that this information is accessible or these interventions are accessible. But beyond now, the information and the accessibility is really to engage and ensure that these voices of these marginalized, minoritized groups of young women and girls are acknowledged and are also heard by themselves. They're speaking for themselves and providing that platform for them to actually see that this is a safe space where I can share, I can be myself, I can express myself. And that has been really something that we have been working towards, to ensure that these platforms are there, this platform is accessible, and it is safe for them to actually speak their realities and speak their truths, and ensuring that these groups of the minoritized, we are getting as many as, or we are reaching out to as many as we can, because we are also stretched with the funds and as an organization that is grassroots, we are stretched with the resources, and we cannot reach out to as many as we would want to reach, but we are making strides through partnerships and ensuring that this is then cascaded through that kind of approach. Yeah, thank you.
Thank you so much, Lucy. I'm going to ask you to put your video back on, and the same for Melvin and for the Rev, because this last question that has come from Gretchen in the chat, I would actually like to put to all of you. So Gretchen has asked, what do you see as missing or needed in your ability to collaborate or work with researchers? And I think this is a question that's particularly pertinent to us as we think about kind of what evidence looks like and how we bring that the lived experience of yourselves and your communities to bear on the work that all of us are doing in this space. And so if I can ask you to give me kind of a 1-minute answer to that question again, what is missing or what is needed in your ability to work and collaborate with academics and researchers? And Lucy, I saw your hand go up, so I'm going to come to you first.
Thank you so much again for the question. And when we're speaking about data, we must acknowledge the challenges that come with the well, we're speaking about research, rather, we must acknowledge the challenges that come with data and how we source for this data, and how what the missing link towards this data that we're seeing on these government portals. So one of the main challenges that we've had, even as organizations that rely on data for advocacy, is that there's a gap when we come into accessing citizen-generated data. the data that is there, or the research that is provided, say example for women, or the status of women of contraception in the country, or the status of HIV within a specific community, is missing from the government portals. And this is a challenge for us, because we've had a lot of cases that are being reported. We've had a lot of interventions and data within the city, within the communities, and within this organizational interventions. And with this, we're seeing that yes, the citizen-generated data would play, or the research or updated research that includes these human stories, the community stories, will be really impactful when we're talking about advocacy in the long run. So I would speak on the citizen-generated data as a gap that is missing while we are sourcing for the larger, we're sourcing from the larger sources of data within the countries. Sorry, my video is a bit, yeah, sorry, you can see me now. Yeah, so I would speak on the gaps that the data, generating the citizen-generated data, and how that has become a challenge, especially for grassroots advocacy. Really has impacted how we work, and a recommendation would be to adopt and to include the government to include this citizen-generated data that is disaggregated well in terms of age, sex, and as well as the different contexts that this data is coming from. Thank you.
Thank you very much, Lucy. Melvin, you've unmuted, so let me come to you next.
Thank you so much, Emma. So in terms of the missing link on academics, researchers, I'd say so many researchers have left their grassroots voices in their researches, in the academic writings. Most of the focus is on, I'd say, the big people who are as seen, quote unquote. As I said earlier, there's less and less information, even when you check online, on young feminist organizing and activism. What you'd see is a written paper about it, but what is the evidence? Something that shows that these are actually young feminist organizers working at the community level, and they're doing the work. I'd say more of the researchers, also depending on what they're focusing on, is they've left behind on women, the linkage between gender-based violence, accessibility to mental health with women and girls with disability, and the sexually minoritized individuals within our communities, and how then our communities, our community organizers are not able to access adequate funding, flexible funding for their community organizing. For YWLI, we've been able to try to bridge the gap, though we are still not yet there, because also our work depends on funding. And if we don't have funding, which means there's someone else who will be affected by that. We've been able to work with the community, young feminist-led organizations who are not registered, who in some way or another have no funding. Most of the young feminist organizers work individually. They respond to cases that happen within our communities with their own resources. And sometimes these things happen at night, and also that impacts their safety as individuals. Organizers working on LBQ rights, mainly within our communities, are really faced with security issues. Some of our network members had to move in 5 different houses within 2 months. Within 2 months, they were able to move in 5 different houses. Their house was attacked by police. Their baby was in the house with a caregiver. So that also brings about the issues of safety and security for grassroots organizers. Yeah.
Thank you very much, Melvin. I think some really important points from both Lucy and Melvin about the types of data, how we disaggregate it, but also as we work with people in communities, how we keep them safe as well. Rev, if I could come to you for your, as we come to the final stages of today's conversation, what would help you in working more effectively with researchers?
Thank you, Emma, and greetings again. Mine, I think we have a kind of a similar problem, because my answer would be more community-informed research. We need that from the researchers with the informed or lived experiences, so that the programs that NGOs engaged in can respond to the need or the gaps that will be identified with the research by the researchers, and also an updated data on health issues and other things, especially as far as men accessing health and is concerned. Because of course it's true that men most of the time are reluctant to use health facilities. But do we have stats that say in my area where I live, 2 men use clinics every month? So that when we mobilize men knowing that we only have, in the total of 30 men we have around the community, only 2 men are using the health facilities. So, thirdly, I know most of the time when we work as NGOs and researchers, we, based on the funder and the expectations that we're supposed to deliver on, most of the time we work with numbers. We need more people to come so that we can say we've achieved what. But if we can now start engaging on more of the quality of the work that we have done, and work with the group, like for instance us, we have been working for the past, I think, 9 or 8 months, if I'm not mistaken, building up to today. And now I can safely say that we've done it because we've been consistent. The inconsistency and maybe COVID has played a part. We no longer see the studies and the research that being done on the ground in the community. Thank you very much.
Thank you so much, Rev. And I think that's a really important part to echo, and is something that we've learned through this process as well, is really the importance of building that relationship, to be able to work together, to have conversations around topics that at times can be quite contentious and nuanced and difficult. And so I think I would add to all the recommendations from our partners to researchers, really kind of taking the time to build those relationships, building that into your funding requests and your proposals from the outset, working with partners right from the beginning to co-develop those grant funds and thinking about how it's distributed in a way that's equitable, and of course making sure any data that is collected is co-owned and shared and is really informed by the needs of communities and gets back to communities for them to be able to work with it. So on that, I'm really conscious that we have run slightly over today. So a big thank you to everybody who has stayed with us. If I could just ask Melvin and Lucy to put your cameras on, if possible, for just a final wave and a hurrah. I cannot stress enough how much of a pleasure it has been to get to know all of you over the past year. And I firmly believe that the work of the Commission will be stronger for all of the time that you've taken away from the important work that you do in your communities to engage and discuss with us and to help us think a little bit differently. So thank you all. If you can give everybody a little wave with your smiling faces. And with that, we have come to the end of today's discussion. Just a reminder that at any point you can find recordings of this discussion and any others on the Lancet Commission's YouTube page. You can continue to engage with us on Twitter and also through our website, Gender Commission. one of our lovely assistants will drop the link to the Commission's website into the chat as well. Do reach out for us if any of today's topics have really appealed to you, or you want to be in contact with any of our fantastic activists. Please follow their socials or get in contact with us and we can link you up. And with that, I wish you all a lovely Thursday and goodbye.
Bye-bye, everyone. Have a lovely day.
Bye-bye.